There's certainly a lot of excitement around the emerging role of BCMA-targeted treatment strategies in multiple myeloma. BCMA stands for B-cell maturation antigen. It's a protein on the cell surface of plasma cells that happens to be very plasma cell specific, and because of that it lends itself very well to myeloma targeting. It's not expressed on other hematopoietic tissues, and it's not expressed on other tissues in the body as well. So we're going to be seeing some very exciting preliminary data with a novel BCMA bispecific antibody that's currently being developed by Celgene. Dr. Costa presented data on Saturday, in the first in-human phase 1 study of that particular agent, and what they're showing is that at the higher dose levels, the majority of patients are responding to therapy. I think it's close to 80-85%, with the majority of those responses being deep responses, a very good partial response, complete responses, many of which are minimal residual disease negative. Very short follow-up. There was one patient that actually had a fatal event of grade 3 cytokine release syndrome, although thankfully all of the other patients have had low-grade cytokine release syndrome and not high-grade cytokine release syndrome. So, hopefully that was just a fluke. That's not going to be common, but with relatively short follow-up, I think that the results are really quite impressive. And, they look just as impressive as what we're seeing with the BCMA CAR T-cell story. So if these data hold up, if these responses hold up, and the depth of response hold up, it'll be very interesting to see how this agent, as well as other BCMA bispecifics that are currently in clinical development, perform relative to the CAR T-cell story.